If you've ever been told to get a cortisone injection for your knee pain or joint pain, stop and watch this video first. New research in the Journal of Radiology just confirmed what we've been seeing years in our clinic. Cortisone shots may give you short-term relief, but they actually speed up joint damage in the long term. In this video, I'll break down this study, why cortisone shots fail so many people, and what to do instead to actually heal your joints. Knee OA affects 32.5 million adults in the U.S. It is a first line of treatment for most medical professionals, and this needs to stop. Here's what the May of 2025 radiology study showed. There was 210 patients. It showed even one cortisone shot increased joint damage progression compared to hyaluronic acid and no injection at all. Overall, cortisone shots had a worse outcome long-term with joint deterioration. Okay, so why do cortisone shots fail? We know there's some joint deterioration, but why else is it a failure to get a cortisone shot? So cortisone actually treats chemical pain. It's a chemical type of treatment. So if your chemical pain, which is the inflammation that comes into the joint, part of that is the normal part of healing, and it stops that process. But it also, if you're treating the source of the inflammation and what's going on, then we need to get to someone that understands what is going on to reduce that inflammation. Because if you treat the chemical part of it, most of the time you're just treating the symptom of what is going on, which is also a problem, which is why you get temporary relief, because it treats the symptom, but the reason why the inflammation is there is still there, and we never solved that problem. Cortisone shots also weaken the tissue. So you have people like never do cortisone shots, like for instance, for like an Achilles tendon. We have seen many clients that have come through here that had cortisone shots for Achilles tendonitis. It weakens that part of the tendon, and it's a loaded type thing that we're doing. Like you're loading, you're walking, you're using it to spring. Like that's what we use that tendon for. And they literally stepped off a curb and it popped from stepping off a curb because the cortisone injection weakened the structure. So that's another reason that we need to stay away from it if at all possible. It also, like I said before, it also reduces the repair process. So part of that inflammation that comes in that is there, it's there to increase all the good stuff that we need to start repairing the process. If you take that process away, you're stopping some of that healing process that needs to happen in its normal everyday process. So, and again, it doesn't fix the root cause of what is going on. Now, there are times when we recommend cortisone shots, but it is so rare because most of the time there's something else that is creating the problem, which gets us into my next topic. Let's learn about the difference between chemical pain and mechanical pain. Mechanical pain is how the mechanics of everything work. If you treat chemical pain that it's a mechanical problem, you're just treating a symptom, which most of the time it's a mechanical problem of what is going on. You fell, you created some inflammation, that's great. Take its course so that you actually have the proper healing time. But after a period of time, if the mechanics of something is causing the irritation, it's much like if you have a wound on your arm and you keep on stabbing the wound, you can go and take medications for that all day long. You can take, something that's going to help the wound heal. But if you keep on stabbing it, it's never going to go away. That's very similar to people that are like, say, I'm not sure what I did, which is the majority of the people. I just started hurting one day. You've got to figure out what is going on. That's what's creating the mechanics, is what's creating the inflammation. You've got to solve the mechanics. And so you've got to understand the difference between the two. Now, chemical pain is that constant aching, throbbing, no matter what you do, it hurts. That is chemical pain. So I always love to give the example of like you can have a kidney infection and it's that constant achy pain that you get in your lower back, but it's coming from a kidney infection no matter what you do. Yes, you take chemicals to reduce the pain, but if you don't fix the infection, it doesn't matter what you do. You can continue to take on the chemicals, but if you don't fix the infection, you're still going to have the problem that is there. Very similar with the mechanics. So you have to understand, or get to someone that understands the mechanics of how everything is working together to solve your problem. So here's the problem with our healthcare system. We treat symptoms. Like, that's just what the healthcare does. Not at our office. We look and try to figure out what is going on, where's the source of the problem. We always say where the side of the pain is often not where the source of the problem is coming from. So you have to understand that. In our medical system, we treat symptoms because we have specialists. So we go see a knee specialist, we go see a back specialist. But none of those specialists are only looking at the one little area and not how the whole body works together, which gives us the problem of like, okay, the only thing that they can offer you is surgery, rest, and an injection. Let's give you an injection and see if we can reduce it. Most of the time people say it felt good for a little bit and then it came back again. If you look at the research on injections, literally like it might be the best thing that you do for the first 6 weeks, but long term, it's the worst thing that you can do. That's what the research says. General exercise, not even getting to a specialist that understands how the body works. General exercise long term is better than injection long term. And so you really, if you can get to a specialist that understands the body, then that speeds everything up. So we've got to understand like where is everything coming from. So too many people are getting pushed into injections and surgery when in reality, you just need to get to someone that understands the body, because you're going to be able to stop a lot of these things from happening and helping your body heal when you get to someone that understands what's going on. Now I'm going to share with you a study that I share all the time with you guys. It was a study that was done, I can't remember when it was done, probably like 7 or 8 years ago. But they basically did research where they had people that were in line for a total knee replacement. A total knee replacement, they were in line, they were going to have the surgery, but they went through the evaluation process of a similar evaluation process that we do in our office. And what they found was that 40% of them, when they went through this evaluation process, they could do some easy knee mobilizations that took their pain away within 2 to 3 weeks. 40% of them did not need to have surgery off of an easy evaluation to figure out, is there something else going on that is limiting that motion, that's making it feel like, oh yeah, there's arthritis in there, but in reality, it's not. 40%. That's a big number. Again, get to someone that understands the body. So what should you do instead? Just like what I just said before. Find someone that understands the body, that's going to spend time evaluating you. And every time you come in, there's an evaluation. What's gotten better? What's gotten worse? What stayed the same? So that we understand what to do next. And we always tell people in our office, whether your body gets better, stays the same, or gets worse, it all gives us information as to what to do and where to go. And it's that constant evaluation as you come through that we pinpoint what's going on and what we need to do. The other thing that we have is shockwave, a regenerative shockwave therapy, which is amazing. We've had such great success, including myself. I've had multiple of my friends, we all grew up playing soccer, went and played high-level college soccer, and multiple of my friends are having total knee replacements in their 50. No, please stop. There are so many things that you can do, and shockwave has been something that's been a game changer for me, that's allowed me to stay active and feel great, as well as other clients. I can tell you, shockwave, we've done more shockwave on knees where people are told they need a total knee replacement, multiple of them. You need a total knee replacement, in the next 5 years, and they're like, I don't want to do it, and they're told to stop doing stop exercising because it could make it worse. And when in reality, they kept on exercising within boundaries, but it made them feel better. Actually, not doing anything made them feel worse. And so they came in and did shockwave. And honestly, we had someone that went from having a hard time hiking 4 miles to hiking 12 miles with no pain, no knee stiffness, and they're coming in to do their other knee. Even though their other knee feels good, they want the other knee to be done because it actually feels worse than their bad knee now. We had another person that was told they need a lateral knee replacement, and they came in and we did shockwave, and they also played soccer, and they couldn't anymore. They coached and they couldn't do anything with the kids. and that drove them bananas. But then after Shockwave, they were able to literally plant, cut, kick, do all these things. Their knee felt amazing. And so there's so many things that you can do with regenerative shockwave therapy before getting into doing injections or doing surgery. And in reality, Shockwave actually helps with the healing process because it increases the blood flow to that area, which is needed. That's where all the healing components are. It will increase the repair process. It brings stem cells to that area. Cortisone shot does the exact opposite. It takes away the inflammation and it takes away some of the blood flow. But that stuff is needed when we start healing, and we need to heal. And when you have tissue that becomes more degenerative, it doesn't matter if you give them an injection. It's a degenerative tissue. This is where Shockwave comes into play to make that tissue young again, because it revascularizes that area that has stopped bringing blood flow to the area, so it can't heal. So you get pulling and pain from that, but Shockwave will stop that in its tracks. So those are all the things that you can do. So the next time someone tells you to get a cortisone injection, remember this: the short-term relief often comes with long-term damage. Instead, focus on solutions that repair, restore, and get to the root cause, like regenerative shockwave therapy. If you found this video helpful, hit the like button and subscribe for more research-backed solutions to joint pain. And if you want to learn more about Shockwave and how we saved our clients from dangerous surgeries and injections, go to the link in the description called Discovery Visit to talk to one of our specialists for free.